So yes and no. And that's kind of the thing here is if this were a medical situation, a person that came in for a medical diagnosis, this would be true. You either have capacity or you don't have capacity. And then a lot of the times, if capacity is taken away, typically the capacitator is going to be the medical power of attorney. If there is one, if there's not, it's going to be like next of kin. If there's no one, in psych, typically it goes to the state, which is an entirely different thing. Now, if I go into the hospital and I say that I want to harm myself and I'm completely alert and oriented, which means, that I have capacity, I understand what's going on, what I'm in the hospital for, and what the implications of not getting treatment are. Because I want to harm myself, I can still be involuntarily admitted. Now, when I'm an involuntary patient, I still maintain the right to refuse treatments and medications while inside the hospital, as long as I'm not actively trying to harm myself or someone else. If I am, that's considered a psychiatric emergency, and medications could be forced on me. But if I continue to refuse and staff continues to deem me a harm to myself outside of the hospital, this can go to court, and I can be court ordered to take medications, or I could be court ordered to spend time at a state institution or other institution within my state that takes involuntary patients. Also, if I would attempt to leave against medical advice, I can't simply sign out against medical advice, even if I sign myself into the hospital. There is something called a hold, which can be enacted if the doctor thinks that I could potentially still be a danger to myself or others. And the amount of time that varies by state, but for my state it's currently 96 hours. So I could be held up to 96 hours against my will, and what that time period is for the physician to file involuntary paperwork if they would choose to do so.